you could understand why we choose Mandaya Hospital in cooperation with Dr. Ebi, Dr. Ben. Is truly one hospital like no other that you have the fortune to have in Indonesia, and probably one of the best, for sure, the most updated hospital in all Asia. So thank you again, congratulations for your vision, Ben, Eddie, and congratulations and thank you for the strong cooperation with Professor Kadir, Dr. Abdillah, Devi. It's really a pleasure to share and to put on the ground all the technologies we developed with the UBRI Institute, with so outstanding scientific committee that I am honored to join in Italy and all over the world, and most of all with Professor Brandimarte, who invented all these patent technologies that now we are going to show in a very short journey for you, just to better understand how the symptoms my colleagues was talking about, the sleep disturbance, child disease, nasal obstruction, pain, all affects your daily quality of life, and how it's easy if we approach them in an integrated approach to solve the problem, even through the ear function. So also the hearing loss, tinnitus, disturbance is possible to be treated using the new technologies that here in Mandaya Hospital you are able to do also from today. So here you will find in this hospital, in Mandaya Hospital, also in the new one, Mr. Eddie and Ben are going to are building just these days, to find the best option to solve the problem of your life that affects quality of life, longevity of your brain, and cardiac and neurological function, both for adults and for your child. So this is really a respiratory syndrome. It's not detached, fragmented symptoms mess of levels. So if you don't breathe well from your nose and from your larynx or your pharynx, you could develop these signs and these symptoms: nasal obstruction, rhinorrhea, post-nasal drip, sleep apnea syndrome, disturbance in your voice production. And this really a syndrome that needs to be approached with high technologies that you can find here in Mandaya right now, the same setting that I use every day in my own clinic with all patients coming from all over the world. Now what we want to do is to approach, as Dr. Abdillah, Professor Kadir, and Dr. Devi, they do every day in they practice here in Mandaya, all this protocol to approach in a unitary way this disease. So remember one of the key track, the take-home message for you: do not under-evaluate your nasal disturbance, your pain, your difficulty in sleep, the child who is always snoring or sneezing, itching, because could be a symptom of a more severe disease. And now it's easy, you will see, to solve all these problems with very high technology, but very simple from the patient side point of view, and saving lots of money for you, for the insurance, for the public health system. Most of all, I want to focus your attention on how the quality of life is affected by nasal disturbance, and how now is possible with structural preservation. Dr. Abdillah showed the surgery we made yesterday with a very fast recovery of the patient that could be operated today and just in the evening go to his place and so stay with their relative without pain, without bleeding, without long recovery, without taking costly pills and so on, with a sort of new medical approach that is in between medical treatment and surgery. So traditional surgery is really out to date. We developed as UBRI Institute, with collaboration with Professor Novelli, Professor Brandimarte, a new way to deliver drugs directly as a gas inside your pulmonary system without damaging the drugs. And with high technology that we patent, and with Dr. Abdillah we discussed a lot, we wrote several papers, articles in specialized journal, we are able to dilate using the natural opening of the paranasal sinuses and of the turbinate. Dr. Devi was showing very nicely in her presentation, dilate to respect the function and so do not induce pain and long recovery time for the patient. Is something similar if we have a big lake and a big river full of pus, full of infection, and we are able to open a small window through the natural pathway of the airway, upper airway system, to restore the function of the affected nose and have an improvement in the whole body function. You know, if you breathe bad, all your life is affected in a negative way. It's possible today to restore this ventilation with very simple techniques, and I'm going to show you, and you will find right now at Mandaya Hospital the best available technique in the world to treat this disease. This is possible to do. We made also yesterday 3 times. So we are able to treat the recurrent barotrauma with this balloon. We have to treat a rhinogenic headache. The neurologist, we were talking about this problem with a strong, proven, safe and clinical evidence results. So the second take-home message for you is these techniques are very safe and very well accepted from the patient, also from the surgeon. Of course, it's necessary to be always update. I every day study, every day update. I develop my own techniques to solve this problem that are not was not yet solved by traditional surgery, traditional medicine. That's why we develop new balloon with Professor Brandimarte, new laser, and we try to arrange new drugs with Professor Botta, new chemical mixtures to treat respiratory disease, a new genetic approach to intercept the phenotypic expression of this disease. We have probably one allergic problem, that is the hidden disease that produce sleep disturbance, rhinorrhea, nasal obstruction. But then with our lifestyle, the smoke habitudes, the allergy, we have several phenotypes. This is what we are studying with Professor Novelli, and again here at Mandaya Hospital you will have a special lab focused on this innovative technology to do not treat one fits for all, but to distinguish, to categorize all these different diseases, to treat in the best way you can find in the world. This is possible here in Jakarta, very much better than in all over Asia. The quality of life is quite easy. We were talking a lot this morning about QMR, quantum molecular resonance. It's a special radio frequency patent system which is able to treat without damage, without thermal damage, without cutting, burning, especially for child, all the airway pathway. This is something I developed, I patent, I wrote protocols. It's a long part of my research field in order to prevent this very big disabling old approach, old surgery. It's something similar if you could squeeze a lemon to throw out all the dust, all the particles, the pollution that your filter, your nose filter act as a filter, without damaging the delicate surface where all the immunological crucial reactions are able to protect our body and to give a long health status for all your life, especially for the child. So we can categorize, develop with patent, with Professor Brandimarte, and also instrumentation, and you can find here all of this, always updated with the best and the newest technique here in Mandaya, always focused to preserve the function and to do not be a geometrical, like a carpenter approach, as it was the previous surgery. So third take-home message, remember today it's possible to restore the function without interfere with the delicate immunological property of the whole respiratory system. Because if you don't breathe well from the nose, you for sure will develop hearing dysfunction, cough, COPD, chronic bronchitis, sleep disturbance, neurological disturbance, stroke, heart failure, and so on. It's the same disease. It's not you breathe bad from your nose, take this pill, take this hypnotic, eat less. No, it's something you need to be aware, be doctor of yourself and recognize in an early stage this disturbance in order to interfere and to stop this march. David was talking about allergic march. This is true. If you start with a bad nasal function, you will develop chronic cough, lots of infection, you have to spend lots of money to treat you with antibiotic, and you start sleeping worse, and so on. You understand? It's a domino effect. It's really a march. Now we can interfere. We can stop. We can modify this natural history. It's possible to do it, Mandaya, 2 floors upstairs from this room. So frontier, lots of frontier. This is our last patent invention. Is a special laser which acts with a special wave. We develop a special duty cycle of application. I go fast. It's something. It's not interesting for you, but very interesting for us as a researcher. We were discussing yesterday a lot with Professor Kabir. We are able to treat in a very delicate manner, again in integrated approach, again preserving the function of your respiratory system with very precise treatment, very personalized, so it's different in each one from another, but with a system integration, and you can find it again in Mandaya Hospital, first place in all Asia, not Indonesia. You are really lucky, you have the excellence of all these techniques, of all these super top researchers in the world here in Mandaya. So you can treat nasal obstruction, oral cavity and pharynx disease. Dr. Abdillah was showing the marvelous explanation of the uvulopalatoplasty, the prolapse that makes you snore while you sleep in the bed, and of course larynx. I treat lots of tenors, of singers, professional voice users, but all of us, we need to take care of our voice, of course. Customize, this is the key track, minimal invasive precision, customized parameter, tissue protection, and most of all, enhanced recovery. Fourth take-home message for you: when you approach with these techniques that you find at Mandaya Hospital, you are able very fast to come at your home, so save money. You don't have to rest and pay for the room in the clinic, and so on. You go again for your child to the school, or you at your workplace. You understand, it's a completely different vision, and we share with Mandaya Hospital and with your researcher and doctor. I personally feel strong the responsibility to be faithful to this mission and to this vision. It's our mission at UBRI Institute with our CEO Walter Spano that is here at our table. So this is really the house specialty, the new, I want to share you, probably some of our colleagues didn't know, is our blue laser. It's very effective new way, since till today it was not possible to treat with this kind of respect of the function of the mucosa, the hearing disturbance, the postnasal drip, chronic cough, recurrence of infection for the tonsillitis, adenoiditis, sinusitis. This is the delicate effect without bleeding. So it's really a blue laser, a new innovative technology that offers unparalleled precision in our procedure. That's why I want to stress you are not a doctor, but it's important that you know when you have a symptom, do not under-evaluate. Go to the ENT clinic, come in Mandaya Hospital and explain your symptoms, because you don't have to be afraid. You can solve it with high technology, but very easy from your point of view, results and techniques. And another technique, again available at Mandaya Hospital, is the COS technique. We talk a lot about rhinitis. You know, rhinitis affects almost 60–70% of general population. Allergic rhinitis, non-allergic rhinitis, infectious rhinitis, pollution, indoor pollution. You are lucky you have the famous painting company here in Indonesia. We are going to talk in a couple of slides to preserve your indoor environment where you live. With COS, we are able to do a kinetic oscillating stimulation, not surgical technique, not at all surgical, in office procedure, to treat with a sort of massage of the inside nasal cavity, interfering with the innervation of the nose, and so in a safe, completely not traumatic, repeatable over the time, so lower cost, no anesthesia, home-based, with this kind of result, you are able to reduce the need of medication, you breathe very much better, you don't have always to blow your nose, to sneeze. We do lots of research in this field, and most of all, improving your nasal obstruction, sneezing, rhinorrhea. You live well after this treatment. And so, again, come at Mandaya once per year, do prevention. Prevention is crucial for the health status for human being. It's very easy, in 10 minutes, it's a procedure that lasts 10 minutes, you can address all the symptoms we were talking about. It's a sort of massage with a balloon and no pain, and you have up to 11 months of good breathing without the need to take a nasal spray that are very, very expensive, as you know, not effective because treat the cause, to treat the consequences and not the cause of this disease. Another innovation, the new balloon. I try to put together all the technologies I've been lucky to try from all over the world to build up an integrated balloon, again to treat in a non-invasive way the simultaneous ventilation of the nose and of the eustachian tube. Just to remember, the ear is connected with the nose through a small canal. This canal could be closed, could be narrow. Now we are able easily to dilate this canal with this special high technology developed with high engineer work together with my scientific committee and Professor Brandimarte. I want to build up a balloon that could make easy with one instrumentation to have a modularity of length, of pressure for a small child, big man, personalizing with a special surgical cockpit. You can have all the length, thousands of possibility to treat all the disease you have. So another take-home message for you: remember that it's possible, using the technology here available at Mandaya, to treat in the early stage all your disturbance, or if it's a little bit late, you yet have the hearing loss, the disturbance. You can interfere and improve the quality of your hearing, the dizziness, the stability, especially for the elderly patient. So remember, prevention is important, but at any stage of your disease, you can improve your quality of life using, of course, using new protocols and new technology. So this is some, again, feature, technical feature, not so important for you, but this is the secret, the heart of our invention, high technology to reach each angulation in a very delicate way, like a snake, with no pain, no bleeding, a fast recovery. Is a day surgery based technology, very personalized, very precise, and so on. This is just to understand high quality again, and most of all, safety for your life. Again, we do lots of training. That's also why the reason these days we had lots of lecture and lots of brainstorming with outstanding colleagues from Mandaya, from neurological point of view, ENT point of view, genetic, cancer treatment, with the most advanced protocols all over the world. And it's something that we want to do to give stability and give good results over the time for your life. Again, another strong facility and research field you find at Mandaya is the regenerative approach with secrotome. Dr. Edi talk and work a lot about this, to regenerate not only for orthopedics, knee surgeon, but even for respiratory diseases. So if you breathe, you have some breathing disturbance, if you had previous surgery and with traditional surgery years ago, now it's possible, remember, it is possible to restore the function and to build up a proper functionality with a proper hydration of the air you breathe, especially in the indoor rooms, allergy, filter, you can restore the filter capabilities of the nose, and all the function with a reconstruction using stem cells and stealth factors to restore hearing function and nasal function. Okay, move on. Some technical feature of this protocol to restore, for example, the hearing function and to come back to swim, and you can again put the water inside your ear with this kind of delicate reconstruction without cut, without needle, without pain, in an endoscopic procedure, high technology, again with the integrated approach, before, after, left and right. And so be doctor of yourself, treat you with the most innovative technology when is needed, and remember that at Mandaya Hospital in Jakarta you can find the best and updated solution for your healthcare, and I guarantee my maximum effort as a co-founder of UBRI Institute to be always updated and connected with our beloved colleague. Thank you very much for your attention.
Thank you.